Hi, it's Dr. Paul here. I've got a young lady with a sore throat. We're gonna go take a look. Good morning. How are you guys doing?
Good.
Good? Does it hurt to swallow?
Yeah.
It does, okay. Strep is usually throat, right? You think of strep throat, but very rarely you can have strep on your bottom. Perianal strep. Did he have that in the past?
That, yeah.
He's had that in the past. That's really, really rare, but just something to think about. If you have a beefy red rash right around the anus, that can be strep too.
Yeah.
Usually with strep throat, you won't have an ear infection. That ear looks perfect. And this side looks perfect. Let's see your throat. Get as close as you can on that. Get even closer. Get even closer. Perfect. Say ah. Excellent. Closer again. Ah. Wonderful. You can back away. Okay, wow. So that's impressive. I'm 99% sure this is going to be strep. Nobody likes having their throat swabbed, but you know what? Because you're so good at saying ah, and I'll be so gentle, ah, all done. You did great. If this rapid test is negative, then we'll run the backup. It'll probably come back positive. So just takes about 5-10 minutes and we'll have our answer. We're gonna go get this going and we'll be right back. So
What you got?
I got a throat culture I need done, rapid strep.
Okay.
On a young lady. Let you go at it because I know you do better than I do.
I know what I'm doing.
So the rapid strep was negative. This is weird. Come on in. Surprise in that your rapid strep was negative. And I find that really difficult to believe based on what your throat looks like. And the family history of all the strep. When you have a negative rapid strep, you're not supposed to treat with antibiotics. You're supposed to send the backup culture, which we are going to do, and wait for that result. But unfortunately, that takes 2 to 3 days. And because we have the strong family history, my experience tells me that there's no question that this will come back positive. Those rapid antigen tests can sometimes miss it. So folks on YouTube land, the rapid strep is for group A beta hemolytic strep only. And sometimes you'll have a different strain of strep, a non-group A strep, that's still obviously causing a lot of problems. And we'll know when we get the results in a couple, 2-3 days, but we're gonna go ahead and put you on an antibiotic. For YouTubers, you don't wanna use amoxicillin if it might be mono. And so this would be a typical situation. If you're gonna treat what we call empiric treatment, you haven't proven it's strep, you're just gonna treat anyway, you wouldn't use amoxicillin because it could be mono, especially if it was an older kid, for example. But you'll be fine with amoxicillin and it tastes great. And so I'll write you that prescription and you'll probably be getting a phone call in a couple days.
Yeah, okay,
all right.
That sounds great.
Super. So folks, a couple days later we got our result. It was positive for strep. Now, what if I'd been wrong? So what if 2-3 days later you get your throat culture back and it was negative? I've put this patient on antibiotics which have their own side effects and they probably didn't need it. Here's what I would do. I would call the patient, ask how they're doing, and if they're not doing any better, they clearly did not need antibiotics because we've got 2 ways of knowing that. First, the antibiotics didn't do any good, and secondly, I have a rapid strep and a culture saying it wasn't strep. So they should just stop the antibiotics. Let's stop the nonsense, so to speak. Generally, I'm not going to start antibiotics anyway unless I have a positive rapid strep or a positive backup culture. That's how we're supposed to practice. This was just one of those rare instances. We had strep in the family. We had just the most horrendous classic looking strep throat. And as it turned out, it was. Thanks for watching. I'm Dr. Paul.